has been a really exciting week on a number of levels. On Tuesday, President Biden said he wanted to get all pre-K through 12 educators and staff vaccinated. And then Governor Inslee followed up quickly with his own directive. And I've been supportive of getting our teachers and staff vaccinated for some time now, so that our kids can get back to school as quickly and safely as possible, and families can start to get back to a little bit something more resembling normal. So that's very exciting. So part of that will be getting our economy back up and functioning again. So this will be extremely helpful. I do hope the federal government is able to dramatically increase our supply of vaccines, and we've got some good news on that front coming up here in a minute. But our biggest limiting factor is still our ability to quickly vaccinate our residents and having supply. That the supply is our biggest hurdle at this point still, but it is getting better. I'm also really pleased Governor Inslee has given a timeline for vaccinating grocery workers and others who've been on the front line of the pandemic for this year. That'll be very helpful. I will note we've given at least one dose of vaccine to over 100,000 of Snohomish County's residents. And that means we're well on our way to reaching our goal, which is approximately 650,000 adults who can be vaccinated. Of course, we need a larger supply every week if we hope to get there, and the sooner the better. But we've made great progress. We're going to keep at it. So, as you know, the partnerships here in Snohomish County are what really give me the great optimism about where we are right now. We have 3 vaccines available now in Snohomish County. We have put in place the infrastructure to vaccinate everyone in the county, and we can begin to see the outlines of how we get the pandemic behind us. So I'm very pleased with where we are at the moment. We just all need to stay vigilant. We've got a little ways to go here, but make sure we continue the positive progress. So with that, I'm going to turn it over to Dr. Spitters of the Snohomish Health District.
Well, thank you, Executive Summers, and I share your optimism. And good morning, everyone. Today, I'd like to give a few quick updates on vaccines being administered and allocated, new changes to the vaccine prioritization phases, and also make a couple of comments about the Johnson & Johnson vaccine. First, yesterday afternoon, we published our slightly revamped matrix of vaccine numbers online at snohd.org/COVID vaccine. We think it provides a clearer summary of our status and progress to date in this vaccine rollout. We hope you find the same when you look at it. It shows that nearly 28,000 doses were administered last week, bringing us to a total of just over 160,000 doses given from December 17 through February 27. Of those doses, 106,000 were first doses and 54,000 were second doses. Now, this week brought mixed news on the allocation front. Last week, we received around 31,000 doses, but this week's allocation for Snohomish County providers was just 13,000. Again, keep in mind that we think our capacity to administer vaccine is closer to 50,000 doses per week. So of those 13,000 doses allocated to healthcare providers in Snohomish County for this coming week, only 3,000, or for this week, only 3,000 were for first doses. Now, that's nowhere near the supply needed to meet the demand and the velocity necessary to get the emergency vaccination rollout completed within 4 to 6 months. Fortunately, the health district also received 5,000 doses of the newly authorized Johnson & Johnson vaccine, bringing the total allocation for the county to 17,000 this week. I'll mention more on that Johnson & Johnson vaccine in a few minutes. Looking ahead, we will be getting next week's projected allocation shared with us from the State Health Department this weekend. We get a lot of questions about this vaccine allocation and distribution process, so I'm just going to try to give a quick overview. First, the federal government allocates and distributes some vaccines directly to vaccinators, and we do not always have visibility on that. This includes the long-term care partnership with CVS and Walgreens to help vaccinate residents and staff living in long-term care specifically skilled nursing facilities and assisted living facilities. Then there's also the federal retail pharmacy program that ships to other chains in Snohomish County like Rite Aid, Costco, Kroger, Walmart, and Safeway Albertsons. Then there's another allocation that goes to the State Department of Health on a weekly basis. The State Department of Health now has a 3-week forecast of state allocations from the federal government for planning purposes, but this allocation is not doesn't branch down to the county level. So our allocation at the local level still comes to us on a week-to-week basis, but it's reassuring that the state forecast shows stable or modest increases ahead. Each week, the state allocates vaccine from that limited supply to enrolled providers through a multi-step process. This starts on Saturdays. So enrolled providers, meaning healthcare systems and clinics throughout the county, place their requests through the state's immunization information system directly to the state health department. This is completed by Thursday night to meet a Friday morning deadline that CDC has for closing out requests. Over the weekend, providers then find out if their requests were approved or denied for the coming week and informed of expected doses and arrival dates. Decisions are made by the state health department on those requests from vaccine providers based on several factors: the proportional population of those eligible in the county relative to the statewide number eligible, completeness of data reporting by vaccinating providers in Snohomish County, vaccination providers' current inventory and documented throughput, and measures of equity. They also look to ensure access at all provider types like hospitals, pharmacies, mass vaccination sites, and clinics. The Snohomish Health District has an oversight role in ensuring providers are properly storing, transporting, and documenting the vaccines. If providers aren't using their supply quickly enough, aren't following guidelines, or aren't keeping up with the data entry into the state immunization information system, then they are at risk of losing future allocations. Remember, though, that allocation decisions are made at the state level, not at the county level. Moving from allocation to eligibility, there were a lot of announcements this week. First, as Executive Summers mentioned, President Biden announced efforts to get a first dose of vaccine into all K-12 staff and teachers and into child care providers by the end of the month. In response, Governor Inslee included these school and child care staff in an expanded Phase 1B1 effective immediately, while also emphasizing that the state's emphasis remains on getting a first dose into older adults as well. Vaccine supply for teachers and childcare workers will come in part from that federal retail pharmacy program I mentioned earlier. The Snohomish Health District has also been working over the last several weeks to match up all K-12 schools with pharmacies or clinics in their area to help with vaccine clinics for teachers and staff. These resources are in addition to other vaccine providers in the area, including the mass vaccination sites. For more information on vaccine locations in Snohomish County and surrounding areas, people can visit the State Department of Health's Vaccine Finder online. Also worth noting, the Veterans Administration Puget Sound Healthcare System also announced this week that they are now vaccinating veterans of all ages. Eligible veterans can call 206-716-5716 to schedule, or they can directly contact their VA primary care provider team. Governor Inslee also announced modifications to forthcoming phases 1B2 through 1B4, as well as timelines to begin each group. DOH released more information on that guidance last night, and we'll be putting a link for that into the chat box. This is good news for many, but it also increases the number of people eligible for seeking a finite and fixed number of vaccines available for each week. So please be patient and know that the entire system, including the health district and the county, are working together as quickly as we can to try to get a dose or 2 doses where appropriate into everyone. So you may not get your vaccine today or this week, but keep trying. You will get one soon. Lastly, I want to cover a couple of points about the Johnson & Johnson vaccine. First, about the name of the vaccine. It's now, I think, affectionately or commonly referred to as the Johnson & Johnson vaccine or the J&J vaccine. You may also hear the term Janssen, Janssen, which is a subsidiary of Johnson & Johnson that is engaged in vaccine production. So you also might see the Janssen vaccine, but we'll try to stick with Johnson & Johnson because that's what people understand. So while we have received our first shipments this week, the State Department of Health doesn't anticipate any further shipments of J&J vaccine until the week of March 22. That's simply a supply issue at the manufacturer level. Now that may change, but remember that it does take a while for a newly authorized vaccine to ramp up production and distribution. And with the 3 vaccines now available, we are hearing people calling around trying to find out where their preferred vaccine is being offered. And as somebody who's reviewed all the FDA and CDC guidance on this, I want to reassure you that while you may think you have a preference on which vaccine you like to get, they're all safe and effective. And it's really best not to wait for another vaccine to be available if you can get one today, unless you've spoken with your doctor and there's some specific medical reason to avoid a certain brand of vaccine. But in the FDA and CDC guidance, there are no medical reasons to choose one vaccine over another other than pre-existing allergy to one of the vaccine components. The Centers for Disease Control and Prevention encourages people to get the first vaccine they can that's available, and the health district strongly endorses that recommendation. As a reminder, even after being vaccinated, people should wear a mask in shared places, avoid gatherings, stay home if you feel ill, wash your hands, and clean and sanitize frequently touched surfaces, particularly in group settings. Please keep up with these preventive measures while we work through to get more people vaccinated and exit from the emergency of this pandemic. So with that, I'll now turn it over to our Director of Emergency Management with Snohomish County, Jason Biermann. Jason.
Thanks, Dr. Spitters. From the Emergency Management and the Vaccine Task Force and, well, first of all, good morning, everyone. Sorry, good morning, everyone. I just wanted to share, we do have some exciting news from our end. We will be opening our 5th mass vaccination site today at the Angel of the Winds Arena in Everett. This site is one of the sites we had planned. It will be walk-in. We are still limited in the amount of vaccine we have available, so it will not be operating at full hours today. But we will open it and begin the process of going through and ensuring all of the procedures and everything are in place in anticipation of getting more vaccine in the near future, and also meeting the demand as the phases open up and additional people become eligible to come in and get vaccinated. As I think Dr. Spitters and Executive Summers both mentioned, this site will be using the Johnson & Johnson vaccine. So we are excited that this will be certainly the first in the county, and we believe perhaps the first in the state that will actually be rolling out use of the Johnson & Johnson vaccine. And just a short note for the folks who are looking at the where vaccines are available, the bottom line is the best vaccine is the one that you're able to get, especially now when vaccines are in short supply. And we are working against a high demand and a low availability of vaccine. Please make an appointment when you can and get the vaccine that's available. In terms of the actual site at Angel of the Winds, we will also be transitioning there to a system called PrepMod. That will be the sign-up system for your appointments. That's the same system that's being used by the State Department of Health and a number of other counties. Our goal with utilizing PrepMod is to make sure that we can streamline the record keeping, which is fairly onerous at our mass vaccination sites. And ultimately, we will, with the mass vaccination sites in Everett, as well as the one in Monroe and Arlington, we will be using this system consistently at those sites so that we can streamline the experience for folks who are coming in to get an appointment. In terms of the overall effort, the site at Angel of the Winds will be one of 3 that is open today. We will also have the Edmonds College point of distribution, and the Boeing Activity Center will also both be open today. We will still have both the Monroe Fairgrounds and the Arlington airports open as vaccine is available. And we plan to continue to do so in the future. We'll also have 2 other sites that will be readily available to activate when more vaccine becomes available. Right now we have 1 location that we're planning in South County to bring additional capacity in South County, and and that will be a walk-in location, and another drive-through location that will be in North County at Boom City. And finally, in and among all of the other mass vaccination activity, there are other activities going on to ensure that we're bringing vaccine out to the folks who are most at risk. Right now in Snohomish County, all 18 of our skilled nursing facilities and 46 assisted living facilities have had on-site vaccination clinics. There are 615 adult family homes in Snohomish County. The last of the first dose clinics for these adult family homes will be finished up this week. Second dose clinics are already underway, and I want to highlight the partnership we've had with several of our fire and EMS agencies to help us bring vaccine out to those folks. We've also worked as a task force to partner with Homage and did a vaccine clinic yesterday for our vulnerable older adults, 100 doses being administered there, and we're working closely with Providence Institute for Healthier Communities to provide vaccines for them so that they can also provide vaccines to marginalized communities. So again, we're very excited about the opening of Angel of the Winds today. We recognize that we're still in short supply of vaccine, but are, as a task force, excited that we're going to have additional capacity that will be vetted, that the processes will be smooth, and that when more vaccine arrives, we'll be able to get it out quickly and safely. And I want to thank the City of Everett, of course, for the partnership. And with that, we'll turn it over to Mayor Franklin.
Yeah, thanks, Jason. Good morning, everyone. We have obviously a lot of good work underway here in Snohomish County. And so I want to thank our partners at the Health District, the county. Thank you for your continued leadership. And I want to thank everyone for their hard work in coordinating and distributing vaccine to our residents. I'd like to give a special thanks to Everett City staff from Police, Fire, Public Works, and our Office of Emergency Management, who's been working in partnership and helped with the walkthrough of the Angel of Winds Arena earlier this year with the Snohomish County Vaccination Task Force. And obviously, I want to also thank the Event Center team who worked to ensure that the site is ready. The site's available space, central location in downtown Everett, and accessibility make it a real ideal site for this 5th vaccination distribution center in Snohomish County. And I'm very proud to have the strong partnerships that work to support our communities with these coordinated efforts to ensure our residents' health and well-being. Last year has been incredibly challenging, but these vaccination sites offer hope and will continue to support our positive progress through this pandemic. We all want to get back to seeing our extended family, attending live events, and simply having lunch with a friend. Getting vaccinated is a step towards that, and I encourage everyone to stay informed and up to date on when you are able to get vaccinated, and do so as soon as you are able. Please stay diligent, stay safe, and together we are going to be stronger. I want to again thank the Health District, the county, and the Angel of Winds Arena for making this happen. Thank you, and I'd like to turn it back over to Executive Summers for the Q&A.
Thank you, Mayor Franklin, and very happy to see Angel of Winds starting up in Everett. Fantastic news. So, a few questions here. Dr. Spitters, any concern that states like Texas and Mississippi pushing full reopening could have a spillover effect here?
Well, in concept, yeah, we don't have as much movement and trade between Mississippi and Texas and Washington than say if it were Oregon, California, and Idaho. So distance protects us there a little bit, but yeah, I mean, so no, I'm not deeply concerned about those particular states, but we always need to keep in mind what's going on in our region and throughout the country, and particularly either large population centers that we have a lot of exchange with, or that are just physically close. So those 2 states in particular don't, put me on edge, but it speaks to the point of we do what we can locally. We can't control what happens outside of our zone of activity, but we do need to remain aware of what's going on.
So next question is, the Everett Clinic in a letter to patients says mass vaccination sites are getting priority and they anticipate limited doses for their patients. Is that your understanding, that mass vaccination sites will cause limits at healthcare clinics for access to vaccines?
Well, that is an express policy item with the vaccine rollout, is at the current time to emphasize mass sites that are oriented toward community health clinics and toward equity-oriented vaccinations. So those are the state's priorities. And so the Everett Clinic is correct in communicating that to their staff. Or to their patient population. That's correct. That is a state policy.
Yeah, Dr. Spitters, how are the case trends along with hospitals and deaths? CDC and Department of Health say they're worried about plateauing of trends.
Well, yeah, the decline in cases is it hasn't really plateaued, but you can see on our website, if you go to our case count tab on our website, you can see that, we're down over 75% off of the peak when we were up at 400, almost 450 cases per 100,000 per 2 weeks. We came down rapidly over the course of a few weeks to about 160 and then 140, 120, 110. So the slope is starting to, flatten. And hospitalizations likewise have flattened. They haven't gone back up. I think this morning there are 25 people in Snohomish County hospitals with COVID, 4 on ventilators, and that's been stable for a couple of weeks. Cases in long-term care facilities, thank goodness, have almost completely disappeared. I think, given that effort to vaccinate skilled nursing and assisted living facilities is almost complete, and almost everyone in those settings has had an opportunity to have their first dose. So overall, things look good. They continue to go down. We've got a great opportunity here to roll out the vaccine while we're not distracted by having to deal with high morbidity. But there is a little bit of flattening, and I think it's a reminder to us all that this can come back on us just as quickly as it disappeared. So we've really got to buckle down, and we're focusing on the vaccination, but all of us need to focus on those simple efforts we can all take to interrupt transmission.
Okay, do we know why our allocation took such a big drop, and are you doing the squeaky wheel to get the allocation increased again?
Well, we're always the squeaky wheel. We're always asking more than we get. I think overall the state has not been able to fill either Snohomish County's requests or statewide requests. They're usually coming in at 2/3 or so of the requests. Why we've dipped from, being in the 20 to 30,000 dose range down into the teens, I don't have a specific answer. It's probably got a little bit to do with, as I mentioned in my comments earlier, their formula for distributing vaccine is not simply per capita. In that case, we just get 10% every week. But sometimes they're looking at other factors as well. And so we'll continue to try to perform and advocate for Snohomish County providers and our mass vaccination sites to get the maximum number of doses we can, because we know we can deliver them.
Yeah, I'll just add on that. My staff, and I know the health district, is in contact with the governor's office and the State Department of Health daily, and multiple times daily. And so we continually express our frustration, and especially as supply drive. We're trying to be understanding, though, the supply to the state comes from the federal government, and so it's a supply chain problem. But we're also asking the state to try to give us more heads up. Currently, we get a couple of days notice on what our next allocation is going to be, and we're hopeful that we can start to get some farther advance notice so we can do our planning. As you can imagine, it's extremely difficult to start up and close down mass vaccination sites constantly. And if we had better numbers, we could do better planning. So again, that's the federal government has started to give the state 3 weeks heads up, and we're hopeful that at some point that trickles down to counties and local agencies so we get more of a heads up. But yes, we are squeaky. Let's see, people who got their first shot weeks ago at the Arlington site are saying they haven't heard anything from the health district, but also can't schedule their second shot until they get an email from the health district. What should they do? Is there a plan for them?
Yeah, I can answer that. The emails go out when we have vaccine available. And so right now, if folks are waiting, it's simply because we're waiting on vaccine. When we have vaccine available, we send out, we maintain a list of the folks who have been vaccinated, and emails are sent out asking folks to go ahead and get online and make their appointment, or call the call center and make their appointment. So that's simply a function of vaccine availability at this point.
Is the Angel of the Wind site getting all 5,000 J&J shots? And is there any concern that teachers could flood the mass sites, freezing out older folks who are less apt at securing doses? Despite the work with pharmacies, I know dozens of teachers who are checking mass sites daily. What's the message to the newly eligible folks?
Well, that certainly is a concern. As I mentioned during my remarks earlier, that we've now amplified the number of people eligible, but not the number of doses available. So now all the school districts, and we're working with the private schools toward the same, are connected with either a pharmacy and or a clinical setting to get their staff vaccinated. And we would encourage all school staff and teachers to orient toward their employer to find out when that clinic's being held and when they'd be vaccinated. But we're also under direction. If somebody signs up in one of whether it's a clinic vaccine provider or one of the mass sites, we are under federal direction to provide vaccine to them as long as they're eligible, including childcare and school staff. Having said that, my hope is that these special arrangements for the schools are emphasized with the school staff, one, for efficiency within their own domain, and also to preserve system capacity for the older adults who are more likely to have severe illness, get hospitalized, die, and cause the kind of impacts that move us backward as we're trying to open up.
And I'll just simply add, if it's okay, Dave. Yes, those 5,000 Johnson & Johnson doses are slated for Angel of the Winds through this week and next. And then just also adding that as we have more vaccine, we also have the capacity to go out, as we did with Homage, to do things that are more localized. We recognize the challenge that elderly folks and others are having in getting to the mass vac site. So we have other strategies when we have vaccine that we can bring vaccine out to them.
How are schools doing in terms of COVID cases? While teachers are now able to get vaccinated, students aren't. Is there concern about outbreaks among students?
Our school numbers are the best they've been since we started counting. From February 19 through March 4, there are 14 school facilities with 1 or more cases, only 2 with 2 or more cases, none with more than 5 cases. And then in childcare, just 4 settings with cases. 3 of those are 2 or more cases, none have more than 5. So that's just about as good as it's been. That's largely driven by what's going on in the community. We're at a declining trajectory and a decreasing level of cases, and it's showing there. So, this is a window of opportunity for us to make a lot of progress with vaccine, again, without being hampered by having to also deal with a high volume of containment efforts.
So long-term care facility operators are saying that once the federal CVS, Walgreens, and 3 on-site clinics are done, the turnover of staff and residents causes their percentages of those vaccinated to drop pretty quickly. Any plan to help them sustain that? So what's a long-term plan for those kinds of facilities that have turnover?
At the federal level, I don't know. At the local level, certainly we would, you know, from the disease control and health officer perspective, those employers should be encouraging those newly arriving employees to go get vaccinated through their personal healthcare provider or one of the mass vaccine sites in the absence of a dedicated, you know, maintenance program, if you will, for that scope of activity. That would be what we suggest for the staff. And then for the elders, you know, they too, like the staff, they're all 1A eligible. So it's just a question of getting somewhere. Most people destined for a long-term care facility come out of a hospital. And I believe most or all the hospitals are vaccinating unvaccinated elders during or at the end of their hospitalization. So, you know, not a specifically designed program, but there are venues and mechanisms just naturally available in our existing vaccine response to address that.
Okay. Now, President Biden's goal of getting every teacher a shot by the end of the month realistic?
Seems so to me, especially, I really think we're fortunate in Snohomish County that the schools have been so forward thinking, and that virtually all the school districts already have a plan. So that speaks well to it. And, you know, if we get to the end of the month and 80 or 90% are done with their first dose instead of 100, well, that's still pretty good, and we can mop up the rest through April. So I'm feeling very optimistic about that.
Okay. And then last question we have is, what should someone do if they are unable to get their second shot in the recommended time? Is it required to get the same type, or Pfizer and Moderna, for example, interchangeable?
Right. So current guidance from the Centers for Disease Control is that only in extenuating circumstances would you interchange vaccines, like have Pfizer for dose 1 and Moderna for dose 2. And although, you know, the goal is to get that second dose at 21 days later for Pfizer or 28 for Moderna, you know, that can go out as far as 6 weeks at least. And, you know, again, that's the target, but CDC is clear that, you know, the idea is to get the same product twice. And if it extends beyond 6 weeks, you do not need to restart the, series. And, you know, I would also just add that 6 weeks is that's a appropriate goal, because that's where the data that's known from the phase 3 trials, that's how long what's been published or recorded in their experience about, you know, antibodies and cases and that sort of thing in the vaccinated population. But if you look at the relative absence of reinfection occurring over the course of the pandemic, and the high degree of protection that we at least see, you know, from the first dose of vaccine in the short run, I think it's still very important for those who are getting a 2-dose series to get that second dose, get it as soon as possible, but also not to worry too much if it's going to come at 7 weeks or 5 weeks. Just try to get it done as soon as possible. Don't worry that you need to restart, and don't worry that, you know, on day 43, you know, after 6 weeks has passed, that you're now become vulnerable. Get it done. Don't rely on just the single dose, but also don't fret over the specific timing. As soon as possible within that time frame, but if it goes longer, I don't think it's reason for people to have anguish or anxiety.
Thank you, Doctor. Thank you, Mayor. Thank you, Jason. I think that wraps us up.
This is Heather in the Joint Information Center. Thank you again for joining us today and your questions. We're going to go ahead and wrap up, but please stay tuned for future media availabilities.